Hey, I'm Connor, and this is your cyber psychology breakdown for Monday, January 12th, 2026. In cybersecurity news, ransomware hackers accessed and downloaded documents containing sensitive health information from Manage My Health. Manage My Health is a patient portal used by healthcare providers and patients. It's primarily used in New Zealand, so most people outside of New Zealand won't be impacted by this specific breach. But it's still important to understand how breaches like this happen, why attackers want health information, and what to do if a similar breach ever affects you. Based on what's been reported so far, attackers accessed and downloaded documents stored in the My Health Documents section of the portal. MMH has said the incident was limited to that module, and that only a portion of users were affected, but investigations are still ongoing. This is basically a side door situation, where the portal becomes the external system that's the easiest path for attackers to exploit. Health information is valuable to scammers, not only because it can be used for identity fraud, as you might expect, but also because it can be used for targeted manipulation. Scammers may target people with a specific health condition and offer them fake treatments, fake refunds, or fake support services to steal money from desperate individuals and their families. There's really no depth some scammers won't sink to. If a breach like this, or a similar one, might affect you, check your account's security status. Lock down your email by using a strong unique password and enabling MFA, and keep an eye out for targeted follow-up scams. A quick little update on a couple other stories. You may have seen some news about an Instagram breach. Meta says there wasn't actually a breach in their systems. It was an issue that allowed external parties to trigger password reset emails for some users. So if you see one of these emails and you didn't request it, just ignore it. The Kaiser privacy tracking settlement claims are still open until March 12th. So keep an eye out for emails or notices if you used Kaiser's portal or app during the class period. You may be eligible to submit a claim. On the psychology side, optimism bias is when we believe rare, bad outcomes are more likely to happen to someone else. We like to think that if we fly under the radar, nothing bad will ever happen to us. A classic 1980 study found that people tend to rate their chances of negative events as lower than their peers. Statistics only apply to everyone else, but I'm the main character of my story, so they don't apply to me. The goal isn't to panic, it's to accept that bad things can and will happen to everyone. So when you get an opportunity to lower the risk of yours by securing your email and important accounts, take it. And as always, stay mindful, stay resilient, remember it can happen to you, and follow for more cyber psychology breakdowns.